and sustaining of relationships with young children and their families, specifically by looking at the theory of attachment. John Bowlby, one of the first writers and researchers to write about attachment, describes the term attachment as the emotional bond that develops between a baby and a caregiver. When infants feel threatened, they turn to the caregiver for protection and comfort. The caregiver's consistent, accurate response to the infant's signal of need, such as crying, helps mold the attachment relationship into a predictable, back-and-forth pattern of interaction that develops over the first year of life. The infant is, in fact, biologically inclined to use the caregiver as a provider of comfort. We use the term secure base to describe the feeling of safety provided to an infant or toddler by a caregiver. For example, you have probably seen a toddler venture off to try something new, but keep looking back to make sure that you, his secure base, are still there and close by if he needs you. The history created between the infant and the caregiver, as the relationship develops, allows the infant to begin to predict the caregiver's response to efforts to seek comfort. There are many things we can do in childcare and in supporting families to facilitate the development of strong attachment relationships. When we consistently and lovingly meet the needs of infants and toddlers in our care, secure attachments are formed. Children who develop secure attachments to one or more adults are more likely to develop positive social and emotional skills. They know that they can rely on adults to meet their needs, to respond to them, and to comfort them. They feel important and begin to develop a sense of competence and confidence. When we are unpredictable, unresponsive, insensitive, or even threatening, insecure attachments may develop. Insecure attachments can make children feel badly about themselves and feel that they aren't important. They may feel a lack of control over their environment and may struggle to develop positive relationships with others. Secure and insecure attachments are reflective of the quality of the relationship between caregivers and children. Our job as early childhood professionals is to form a close and attached relationship with every child that comes into our care, as well as to promote the parent-child attachment. How do you know an infant is attached to someone? Infants show their attachment through proximity-seeking behaviors, which means that infants like to be near those that they are attached to. Infant attachment can be observed through infant behavior. As a caregiver, you will know if an infant is securely attached to its parent and attached to you by how they react when faced with separation. Harry Harlow conducted some of the first studies looking at attachment. He did this by separating infant monkeys from their mothers a few hours after birth. He provided two different surrogate mothers. The soft mother provided no food or milk, while the hard and wire mother had the milk. He was aiming to evaluate whether feeding or comfort contact was more important to infant attachment. Results of this study showed that monkeys would go to the wire monkey to feed, but then return to the soft monkey mother for cuddling and spend most of their time there. This disproved many who at the time believed that the reasons infants attached to their mothers was purely related to food. A third group of monkeys were given no monkey mother surrogate at all. When Harlow placed his subjects in total isolation for the first 8 months of life, denying them contact with other infants or with either type of surrogate mother, they were permanently damaged as adult monkeys. He found that, just as they were incapable of having sexual relations, they were also unable to parent their offspring, either abusing or neglecting them. Dr. Harlow said, "Not even in our most devious dreams could we have designed a surrogate as evil as these real monkeys were. Having no social experience themselves because they were isolated as infants, they were incapable of appropriate social interaction. One mother monkey held her baby's face to the floor and chewed off his feet and fingers. Another crushed her baby's head. Most of them simply ignored their offspring. Although these studies are widely considered unethical today, they provide important groundwork for the theory of attachment." Later, Mary Ainsworth with other colleagues expanded Bowlby's theory of attachment by defining 4 types of attachment relationships: secure attachment, insecure resistant, insecure avoidant, and insecure disorganized attachment. Ainsworth devised an experiment called the strange situation. The security of attachment in 1 to 2-year-olds were investigated using the strange situation paradigm in order to determine the nature of attachment behaviors and styles of attachment. Ainsworth developed an experimental procedure in order to observe the variety of attachment forms existed between mothers and infants. This experiment is set up in a small room with one-way glass so the behavior of the infant can be observed covertly. Infants are aged between 12 to 18 months. The sample comprised of 100 middle-class American families for the first study. The procedure, known as the strange situation, was conducted by observing the behavior of the infant in a series of 8 episodes lasting approximately 3 minutes each. The procedure for the strange situation went as followed. The mother, the baby, and the experimenter would be in the room. This would last less than 1 minute. Then the mother and the baby would be alone in the room. A stranger would then join the mother and the infant. The mother then would leave the baby and the stranger alone. Then the mother would return and the stranger would leave. Then the mother leaves and the infant is left completely alone, briefly. Then the stranger returns, and then the mother returns and the stranger leaves. The results of this experiment would determine the type of the attachment for that child: secure, resistant, avoidant, or disorganized. The most prevalent kind of attachment profile is secure attachment. Children who are securely attached have a relationship with a caregiver that is built on trust and confidence. During the strange situation paradigm, these infants, seem to say, "I missed you terribly," they cry, "but now that you're back, I'm okay." They're easily comforted. Infants become attached to individuals who are sensitive and responsive in social interactions with them, and who remain as consistent caregivers for some months during the period from about 6 months to 2 years of age. This is known as sensitive responsiveness. When the infant begins to crawl and walk, they begin to use attachment figures, those familiar people, as a secure base to explore from and return to. Caregivers' responses lead to the development of patterns of attachment. These, in turn, lead to internal working models which will guide the individual's perceptions, emotions, thoughts, and expectations in later relationships. Separation anxiety or grief following the loss of an attachment figure is considered to be a normal and adaptive response for an attached infant. Some characteristics of children with secure attachment relationships are that they trust that their physical needs will be met by adults. They may explore their environment and return to their special adults when needing a hug or encouragement. They trust that adults will be emotionally available. Children learn that they can be intimate, close, and cherished with another person and still be safe. They learn to communicate in a variety of ways. Children's language uses can develop into more complex forms, for example, from sounds to sentences. And they begin to manage or self-regulate their strong reactions and emotions with adult help. Caregivers can support children's management of emotions, such as soothing or showing ways to help calm down when upset. There are 3 types of insecure attachment. The first, insecure avoidant attachment, is when infants or young children seem somewhat indifferent toward their caregiver and may even avoid their caregivers. If the child gets upset when left alone, they are easily comforted by a stranger, the same as they are by their parent. As if to say, they are saying, "You left me again, I always have to take care of myself." 20% of American young children have avoidant attachment. Resistant ambivalent attachment is when infants or young children are clingy and stay close to their caregivers rather than exploring their environment. The baby is upset when the mother leaves and remains upset or even angry when she returns. The mother or attachment figure is unable to console the child. About 12% of American children are resistant or ambivalent attachment type. When children have experience with parents that leave them overwhelmed, traumatized, and frightened, the youngsters can become disorganized or chaotic kind of attachment. They have no consistent way to cope with the stress of the strange situation. They seem confused when the mother leaves and when she returns. Children who have disorganized attachment have problems with emotional regulation, social function, and sometimes severe emotional problems. Less than 5% of middle class American children fall into this category. There are some criticisms of attachment theory and the attachment theory types, mainly that children can be attached in different ways to different caregivers, not just mothers. For example, one research study done with African American babies incorrectly assigned attachment profiles when they used the mothers as opposed to grandmother or other primary caregivers. More research is necessary on attachment profiles among culturally, racially, and ethnically diverse children and families. Some of the characteristics of children with the three different insecure attachment relationship types are they behave as if they know that adults are inconsistent or seldomly available, so they may not seek out help or validation for emotions. Or they stay close to an adult to get their needs met, inhibiting their exploration of the environment. They may act in a way considered clingy, such as refusing to interact with peers despite caregivers' efforts to support their play with others. They do not seek adult help, to deal with emotions when distressed. They avoid adults. They hide strong feelings, withdraw to avoid distressing events, or to organize their emotions. They may not show when they're upset by others. Or they can seem disorganized and confused about how to behave in relationships. They may not show emotional reciprocity with their peers or other adults, such as returning emotional closeness to others. Caregivers of infants can help foster the parent-child relationship. They can help parents feel competent and confident in their parents, such as noticing and describing when parents are warm, responsive, and nurturing with their child. And they can help parents recognize their strengths as parents. They can also provide extra support to parents when needed, such as when a child has an illness or has difficult behavior, a disability, or a temperament that can be challenging. Caregivers can also foster their own secure relationships with the child. Caregivers should be warm and responsive and affectionate with all children. They should read and respond to children's cues. They should watch for smiling, reaching to indicate what the child wants when they want to interact, pulling away when they indicate that the child wants a break in interaction, when the child shows sadness. They can engage in meaningful conversational interactions with children, taking turns speaking. Caregivers can be physically and emotionally available as children explore their environment. Allow the child to explore, but then provide hugs and encouragement when needed. Always consistently comforting children when they are distressed.